Thanks for joining us on Wellness Talk Radio. I'm Kris Costello, and today we are talking with Janie Bowthorpe, and she has got an amazing book and website out there called Stop the Thyroid Madness. Janie, thank you so much for being on the show today.
Oh, you're welcome, Kris. I'm so glad you asked me because there is so much to talk about.
And, you know, your website, I've been doing lots of research, and your website is one of the places I went to get fantastic amount of information about thyroid issues. I want to start just so people know a little bit about you. How did you end up doing this kind of advocacy?
I actually call it activism even more because I was so upset. I am a person who became hypothyroid and went through this a treatment that millions of people go through, which doesn't work. And I paid terrible prices for 20 years. It was miserable. Now, if you had known me, you wouldn't have known it was miserable because many of us with thyroid disease don't appear to be as sick as we are. But I was very sick. So to answer your question, what led me into this was a combination of finding out, number one, that the medical profession didn't get it. They have done it wrong for a long time. And the second reason that I got into my activism advocacy is because my life changed dramatically because of something I found out and brought into my life. And that blew me away, that why was this never told to me in those 20 years? So those are the two reasons why I started this.
And so what happened exactly in the beginning? What were you diagnosed with, and what's your story?
Well, what happened was, like I said, like millions of people, I was put on a medication which is it's called T4 only. You may have heard the name Thyroid. There used to be Levoxyl. There's levothyroxine. There's L-troxin, etc. It is a T4 only medication. And for over 50 years, thyroid patients have been put on this medication and then told you're now adequately treated. But the problem is we have never been adequately treated on this medication. Now, granted, there are some people who do better on it than others. I wasn't one of those people. I was one of the people who never did well on it, and I kept getting worse and worse till I was going to apply for Social Security disability. And all that time on Thyroid and later Levoxyl, I was told, oh, it's not your thyroid, you're adequately treated. So that's what was wrong.
So you had 20 years of basically being very sick, and yet clinically they basically said you were being treated.
Well, yeah, because there comes the other part of this story. First of all, number one, doctors are told, and they will tell you in their medical school training, they were only taught about Thyroid or T4 only medications because that was pushed on the medical society by 1960. And so that's all they're taught about. And then the second side of this problem is that they use a lab test called the TSH. That stands for thyroid stimulating hormone. The TSH hormone is released by the pituitary, and it's meant to knock on the door of the thyroid to tell it produce. So by early 1970, doctors started being taught that this is the test you can use to discern if a person has hypothyroidism and to discern if they're adequately treated. And that's the second part of this horror story. The TSH lab test does not work. It can be normal for years before it rises high enough to reveal that you are hypothyroid. Secondly, even on treatment, it can look normal, but that test, which is a pituitary hormone, does not tell you whether all the organs and the cells in your body are getting enough T3. So now we have two failures. Thyroid has been a failure for millions of us, or any other brand of T4 only. And the second failure was the use of a pituitary hormone to discern that we were either hypothyroid or not, or that we were properly diagnosed, and it has failed us.
Let's go back a little bit, though, for people that are listening and are trying to figure out what their issues might be. What are some of the common symptoms that people with thyroid issues might experience?
There are a variety of symptoms, but the most common ones are easy fatigue. A lot of people have easy weight gain. Thinning of the hair, like you can see your hair getting thinner, your outer eyebrows getting thinner, drier skin, poor reaction to exercise, in other words, you don't recover well. Depression, believe it or not, is a common symptom of hypothyroidism. Rising cholesterol is a common symptom. Aches and pains is a common symptom. Of course, it's going to be individual what you're going to manifest, but those are the more common symptoms of being hypothyroid. The need to take a nap in the afternoon is a common symptom.
And if you go to your doctor, what are the normal tests that you will get? And let's talk more about that. I know you have a ton of information.
Up until, Stop the Thyroid Madness has played a huge role in changing the way doctors try to diagnose it. But unfortunately, there's still a large body of doctors who have not caught on to what we've learned as patients. So they're going to tend to test just the TSH, and maybe the total T4. T4 is one of 5 hormones, thyroid hormones, and T4 represents what your body stores. So they're testing your storage hormone, and they're testing a pituitary hormone. And those can fail you because your TSH can look very normal. And I know of people who've gone 15 years and more with a normal TSH, yet they were severely hypothyroid. Your storage hormone can be in the quote-unquote normal range, but that doesn't mean you're normal. It could be low.
So what are the tests that people need?
It's not just the tests that people need. It's going to be a combination of tests, and there needs to be better clinical observation in that office. So as far as the tests, what doctors need to look at, you can use the TSH because you want to find out, does this person have hypopituitary? But what you really need to pay attention to as far as testing, we as patients have learned, is the free T3 and the free T4. Free represents what is usable and available by your body. T3 is the active hormone. You need to see how much of that active hormone. But even using the right test, the second thing we as patients found out is you've got to understand how to read it. In other words, a big mistake we see the doctors we care about make is they think if your free T3 and your free T4 falls anywhere in that so-called normal range, you're normal. Well, you're not, because there are places it should fall in that range. For example, we see when people do not have a hypothyroid problem, their free T3 is generally going to be above the middle range. Now, a minute ago I just said that's part of it. The clinical observation. They need to look at, along with the right testing, what are symptoms that these patients are manifesting. Are they having easy fatigue? Is it especially prevalent in the afternoon? What's their body temperature? Because with hypothyroidism, I didn't mention this a minute ago, it tends to be lower than normal. Are they experiencing depression? Is their cholesterol and blood pressure going up? Are they having easy weight gain? What's their stamina like? Is there hair loss? You've got to pay attention to those as well.
A lot of times if your numbers are normal or within range, then all those clinical symptoms that brought you into the doctor are just ignored.
Oh, I can't tell you how many people have reported that. And I'm talking about worldwide. I work with patients worldwide, and I can't tell you how many of them have reported what also happened to me, even though they went in there with raging hypothyroid symptoms because their TSH was normal, the doctor dismissed it. And the doctor said, you need to exercise more, you need to eat less, you need to see a psychologist. That happens a lot to this day.
Right. And so what do people do? I mean, what if there's a lot of people, their insurance only covers this kind of, let's look at the TSH, and if it's normal, that's it, we're done. What do people do? Where can they go to figure out which tests they need? I mean, obviously, your website is a huge wealth of information, as I've figured out, but what do they need to do?
Well, that's why the website exists, because I knew that who what doctor is going to listen to Janie A. Bowthorpe? They don't know Janie A. Bowthorpe. Who is she? And then you have the criticism, Janie Bowthorpe's not a doctor. Well, I realized that was going to happen. So I thought, what I've got to do is compile what we as informed patients have been learning, because we were forced to learn it ourselves, because the medical profession didn't get it. And we were learning a lot, and we were getting well. So Stop the Thyroid Madness is where they can go, because I have compiled, here's the right lab work. Here's how to read that lab work. In other words, the whole website is to teach you so that you in turn can, one, find the right doctor, and or two, teach your doctor how to do this. So there's certain lab work you need, which is on the website, and there's more in the book. There's certain ways you got to learn how to read the lab work, and there's definite ways that you want to treat hypothyroidism, which is not what they've been doing to us for over 50 years.
And another test you mentioned is the TPO and how that's an important number. Why is that so important?
Well, the TPO, that's one of two antibodies. In other words, there's a large body of thyroid patients who have the autoimmune form of thyroid disease. And that means the immune system is a little messed up, and it's attacking the thyroid as if it's some kind of vile enemy. And you've got to get two, not one. That's another mistake we see made a lot. You need two antibodies lab tests, the anti-TPO and the anti-thyroglobulin, to find out if you have the autoimmune version of thyroid disease. Because though your treatment is going to be the same, there are some other things that Hashimoto's patients have to do to control those antibodies that those without antibodies don't have to do as much of.
And what are the numbers for TPO if it's above?
You will notice the range. You know, like they have over the years come up with this range, like if you're less than 20, you're fine, or less than 10, you're fine. Now, we kind of agree with that. Now, remember, I'm about patient experience. I'm not about opinion. And we've noticed from our experiences that a lot of people will have a small amount of antibodies without having full-blown Hashimoto's. So if you're way below their quote-unquote normal range, you're probably okay. But what we've noticed is the person whose antibodies is getting close to that borderline, like if it says less than 20 and they're at 18 or 21 or 22, now's the time to be concerned that, yep, your thyroid probably is being attacked, and you need to do some things about it.
Right. Now, I think with TPO, the range is something like 38 or something.
It depends on the facility, but sometimes it's less than 20 that you're normal. Sometimes it's less than 34. It just depends on the facility you use.
Right. So what if someone's like in that 39 range? What does that indicate?
Then you have to be concerned, because that tells you, okay, now you've got more antibodies than somebody else does. Like somebody might have 4 and you're 39, you're right up there. So now it's time to be concerned that, yep, my body may be turning against my thyroid and attack is beginning.
Could that also just be some kind of generalized autoimmune condition, or is it always specific to the thyroid, as in Hashimoto's?
Well, that test, the anti-TPO thyroid peroxidase, and the anti-thyroglobulin, you got to mention both of them. Those tests are particular to Hashimoto's disease. There are instances where somebody can have what's called Hashitoxicosis, and they'll have both the thyroid antibodies and the TSI, which is Graves' disease. They can have all the antibodies. But the significance that, as we understand it from what we've read, that the significance of having these thyroid antibodies is that you have a greater risk of having other autoimmune conditions. So that's why you want to know if you have it, so you can keep an eye on whether you're going to move into some other autoimmune condition. It
seems that these thyroid conditions are on the rise. And have you heard that? Have you seen that over the years?
You know, who of us have been alive long enough to know? We're looking at it. We think that there's an increase. If you look at the percentage of thyroid disease versus the population 100 years ago, is it a lot higher? Maybe it is. And if so, it makes sense if it is, because we get the impression from what we hear that you and I and everybody is exposed to a lot more toxin than we used to be. There's things being dumped in our water. There's being things in the soil being buried, and that's crossing over into our foods and into our water. We now have to deal with fluoride in our water, which many of us feel was a huge mistake, could be contributing to the incidence of thyroid disease. yeah, we think that's a big problem. And so is, by the way, if you've heard about it, we're now into genetic testing. And we're finding out that a large body of people have particular genetics which make them more susceptible to having these problems.
A lot of people talk about nodules and goiter. What are those, and what kind of treatments are available, and what do people do with those kind of diagnoses?
Well, those can represent a couple of things. In other words, if you have Hashimoto's disease where the thyroid's being attacked, it can be common to have those swellings. Just picture them like little swellings, that you'll have nodules on your thyroid. But we've also seen that some people can have swelling in their thyroid and nodules just from being hypothyroid. And then there's a third, more rare situation, and I say that, it is more rare, where somebody could have a nodule because they have thyroid cancer. So whenever you have nodules, you don't have to just freak out, oh, I've got thyroid cancer, because most people do not have thyroid cancer. But you look into it, and the majority of people, if they have nodules, it's probably related to having Hashimoto's, which is the autoimmune thyroid disease, or just being hypothyroid. And if it's not cancer, those usually go away with the proper treatment.
So is it important to do a biopsy, or do you do natural treatments first? What do most people do that you talk with?
Well, that's only if there's suspicion of cancer. Would you do a biopsy? That's where the doctor can be good. They can feel it. They can look at it. They can do a scan if they're suspicious. What you're looking for is growth. And if they're seeing some growth, then they might be suspicious, and they might do a scan to see if it might look like cancer. And if there's suspicion, then they're going to do a biopsy. But I don't want to frighten people here. That's not the rule. The vast majority of nodules are related to Hashimoto's or being hypothyroid.
And how do people go about finding the right way to get this treatment?
You just find the right doctor. See, this is what we've had to compile. We have a private list that patients have been contributing to of where the doctors are who will prescribe desiccated thyroid. So we have a private list that we've been compiling for over a decade of where they are. Even if you don't have access to that list, there are certain strategies you can use to find a doctor who prescribes desiccated thyroid. Like, for example, there was one time when we moved, and I was in a kind of a rural area, and I had to find a new doctor. And I kept hearing that they were terrible. They were still hooked on Thyroid, and that's not what I wanted. So I thought, what am I going to do? And I made phone calls to a new doctor in town. Oh, no, she's into Thyroid. So what I did was I went to the nearest pharmacy. And I went to the window. In fact, we were in the car, and I said, what doctor in this area prescribes desiccated thyroid? And the pharmacy's going to know. And they gave me a name, and I found my doctor that way. And that's a really good way to do it. So on the website, there's more to do, but I have a page on Stop the Thyroid Madness called How to Find a Good Doc. And that explains how you find a doctor who will prescribe desiccated thyroid. But understand, that's only the first step. That being on the right medication is the most important step, but you also have to learn how to dose it and be willing to teach your doctor how to dose it. And it's not by the TSH. You have to raise it. You watch for the removal of symptoms. You have to watch for many other things that I go over on the website.
And Janie, I want to make sure that people can find your website. How do they find it?
It's pretty easy. It's just stopthethyroidmadness.com. And it's a very large website. I've been packing information into it for a decade, and that's an easy way to find it. Stop the Thyroid Madness.
Great. I think you have some info on Facebook, too, right?
I have a Stop the Thyroid Madness site on Facebook where we give information every day, and people can comment on it. And then associated with Stop the Thyroid Madness are patient groups. They're called FTPO, for thyroid patients only. So if you go to Facebook, you can type in FTPO, and then you'll see there's many of them. There's one for adrenals. There's one just for thyroid. There's one for T3 only. There's one for sex hormones. There's several of them. I think there's about 9 or 10 of them. There's about 10 of them. And you can pick the ones that you want to join. And in those websites, those groups, you will have admins who are very familiar with Stop the Thyroid Madness, meaning they know what patient experiences are, and they can also help you there. And there's, of course, also the book.
You're listening to Wellness Talk Radio. I'm Kris Costello. We're talking with Janie Bowthorpe of Stop the Thyroid Madness. You can find her website, and we just mentioned it, stopthethyroidmadness.com. And you can listen to the archived interviews on wellnesstalkradio.com. So, Janie, one of the things I want to ask you about is the how do we take care of the thyroid? What do people do to kind of avoid getting this in the first place? Are there any ways to do that?
That's kind of difficult. I think let's just play like that somebody's listening, and as far as they know, they don't have thyroid disease. Or let's play like somebody's listening, they've got children who don't have thyroid disease. And they may wonder, what can I do? What can I do to not be there? What can I do for my children? How can I educate them to not go there? Well, understand that some of this is genetics. There's just nothing, some people can do nothing about it. But there are some things that might lower the risk. One is keeping track of your iodine levels. See, thyroid hormones are primarily composed of iodine. So and there is a lot of research that our soil is low in iodine, so thus our food is low in iodine. So there's a possibility that if you keep up with your iodine intake, and I'm not saying too much, I'm saying just the right amount, maybe you can avoid thyroid disease. But understand, I have 3 sons and none of them got it. So there is a genetic factor, but I'm still not going to avoid saying, keep track of your iodine level. You can do what's called an iodine loading test. You can order your own, and it's urine, and you can see what your iodine levels are. Secondly, there's all sorts of nutrients. You can get on the internet and just type in thyroid nutrients, and you can find out what kind of supplement should I take to promote good thyroid health. For example, the mineral selenium is known to help conversion of T4 to T3. And vitamin C and the B vitamins are all many good things you can take to promote good thyroid health if you can lower the risk.
I know when patients, sometimes they'll be told things, if there is a thyroid issue, they'll be basically just given the information that the only option is to surgery to take out the thyroid. What do you think about that?
First of all, it's very rare that a doctor is going to tell a patient to take out the thyroid just because they have thyroid disease. But I have heard of patients who simply had Hashimoto's disease, and they were told to have their thyroid taken out. And we, as informed patients, are aghast at that because you can treat Hashimoto's disease. You'd have to have it taken out. Now, even deeper than that, there are doctors who recommend a thyroid taken out because you have cancer. I am never going to tell somebody not to have their thyroid taken out because they have cancer. You may need it taken out if you have cancer. And that's going to have to be an individual decision. But I also know of some patients who would prefer to treat thyroid cancer naturally, and they're going to take the risk. So if you are told you have thyroid cancer, then it's up to you to do your research, look into iodine. There is a gal who's got a website up, and I think it's called Natural Thyroid Choices or Natural Thyroid Solutions, something like that. Stephanie Bust, who wishes she had gone that route. She wishes she had looked more into iodine and supportive nutrients, not to have her thyroid taken out. But that's an individual decision.
What are the problems with taking out the thyroid?
The thing about not having a thyroid is people without a thyroid feel like that they experience things harder than those of us who still have a thyroid. That could be. They feel like they experience hypothyroidism harder. There's a psychological factor knowing that, oh my God, I can't live without a thyroid. So that's what they've told me, that they feel like things are heightened, symptoms are heightened, things feel worse without a thyroid. I don't know. I still have my thyroid. But I want to say to you that even with my thyroid, it shrunk because I've been on thyroid medications a long time, so it's probably quite small and probably wouldn't even work, and I still need thyroid hormones. I must have had a genetic reason for my thyroid to fail. So I still have to be on thyroid meds. But anyway, that's the answer to your question. They say they feel things a little bit worse.
Yeah, and I never realized until I started researching this and saw your website, the stopthethyroidmadness.com, that the thyroid is super important. It kind of regulates, it's like the driver of your system. I had no idea. I had never thought about it.
Huge. Master gland.
Yeah, I think people don't know this.
No, it's a master gland. I mean, you know how we can see that as thyroid patients is when we get hypothyroid, here comes depression. So we know it has something in the brain, serotonin levels. Here comes brain fog, another reaction you need thyroid hormones for brain health. Here comes a rise in cholesterol. So we know that thyroid hormones, which affects your metabolism, if it slows down, you're going to have fatty acids build up in your veins. If you don't have thyroid disease, they're going to have a better chance of getting out. Here comes fatty liver disease. So that tells us a healthy thyroid has a positive impact on your liver. Some people report kidney problems when they get into hypothyroidism, so we can see that it must have some role in kidney health. Here comes heart problems when you have hypothyroidism. So conversely, that tells us that the T3, which is the primary hormone, has something to do with heart health. Here comes, if you're hypothyroid, your skin dries out, your hair falls out, so we know it has something to do with hair and skin. See, I've touched many parts of your body there. So we know by what it does to us when we're hypothyroid that we can see what it does for us in a positive way if we weren't.
So, Janie, I want to thank you so much for being on the show today. And in a nutshell, I'd love you to talk a little bit about, and I know people are going to want to find stopthethyroidmadness.com to find out more information. But what are some of the steps that people, if they're suffering from this, they can do, what they need to do to get the information and start turning their lives around?
If you suspect that you might have thyroid disease, or if you do and you're still having problems, learn from patients before you. That is what Stop the Thyroid Madness is. It's a compilation of what patients worldwide have figured out and have experienced to get well. And learn from them. Be open to what patients have learned and draw upon that knowledge. It's all right there for free, right on the website. The book has even more detail. It's only $19.95. It gives you even more information. And be open to what patients have learned. As you learn this, be prepared that you're going to have to guide even the best doctor on some of these areas because they're busy. They can't all keep up with this. And so you're going to have to say, I love the first thing you said, but, here's what I've been reading patients have been doing, and I want to do it. And be prepared that you're going to have to do that. So bottom line, you are your own best advocate. So learn from patients before you and be prepared to use it.
We recommend checking out stopthethyroidmadness.com. And Janie, thank you so much for being on the show.
You're welcome. Thank you.